whole nother system, but we want, the big price tag was the ability for them to talk to each other. So I've been able to work something out. I have something else to show you that's more reasonable than the other one. Still an investment, but I've been looking at a lot of other products, continuing to search, even looking at some things that are more special district focused and Parks and Rec, but nothing has really been, exactly the right thing. But we have something I think can work.
So that's separate from. You're saying you found another vendor?
I've been working with the original one that had seemed like the best fit to get the pricing down.
Okay.
So,
I'm letting her be the negotiator.
yeah.
Good.
Because my initial was, are you crazy?
So I'm hearing two things. One is it would alleviate some of the drudgery around scheduling events. Did I understand that?
It would prevent double. So if we have a software that's working well, or how do we give 11 different spaces, and how they're being used and everything that goes with that. But if we're going to track who's in each of those events that we've already put in that system, we would have to re-enter them into a lot of systems. So I was able to find an integration so that we wouldn't have to
With another vendor or with the same?
With a
Same
different fit.
Oh,
So there's
okay.
going to be two software. There's the scheduling software,
yes.
and then there's the CRM.
provided
Yes.
by the same vendor,
No,
There's
two
two different vendors.
two different
Okay,
vendors.
but somehow they'll be able to talk to each
Yeah.
other?
Yes.
Yeah.
Well, bravo, Teresa.
Yeah.
So let me make sure, I'm gonna bring it to its fine point if I may.
Yeah.
This is going to be able to tell us how many individual people
Yeah.
visit our center, plus participation numbers. In other
Yes.
words,
Correct.
I came 5 times.
Yep.
And then you're also gonna be able to know that I was once in this and once in that and once in that and once in that. Okay.
Yeah,
Okay.
that's what we'll be able to do.
Well, when we get that, I don't, are we talking $1,000 a month? Are we talking,
Yeah, somewhere around there.
It was an $18,000 startup bill.
Yeah.
okay,
And the ongoing costs
No, the
were
18,000 was the ongoing costs.
annually?
Yeah.
right. But it wasn't going to be 18,000 every year because there was a $4,000
Yeah.
initial onboarding. That's still
Okay.
it,
It would be about $1,000 a month with those figures you just.
potentially,
said.
yes. There were a few other things that
Yeah.
made the price move around to
Yeah.
the point where we
Yeah.
weren't quite sure
Yeah.
that it was gonna work. There was
Yeah.
some potential extra charges and things that
Mhm.
I sent
Yeah.
back to the negotiator.
Okay, well, we'll have to see how low they will go and then do a value versus
Mhm.
cost analysis of the data. And we'll see where we land. But thank you for spending time on that.
Anyway, yeah.
Your brain's going.
Okay. Well, every salesperson wants to tell you it can do, it can
Yeah.
do everything.
Yeah.
Is there anything in there in that program specifically where you're just like, this isn't gonna work with what we're doing? Or is it mainly like everything is, because I know it's not everything is
Yeah.
is what we're looking for, but is there something in specific that might be like a big issue?
You know what, when you're looking for integrations and you're looking at all of this at the design level, it looks like it's all gonna work. So there's always that like, all right, let's pull those reports now. Is everything coming, together as expected? But as far as I can tell, I think it's gonna meet our needs and it will give us some more, where it's interesting, it'll give us more like, insight into people and like, have they been on our website? What emails they've seen and some other information like that. And there could be the potential, there's a package for surveys that might be helpful and help us automate our surveys. So that would be like a bonus. Yeah.
Okay.
We at first tried to find one tool that would do all the things. That obviously did not exist. And so we parsed it down to what is the most priority level data.
Yeah.
And see where we could find with that. And then, of course, obviously, one of the highest parts was could it integrate? Could it talk with
their scheduling software that they're using.
So let me ask you a question. If we weren't interested in census data down to the individual, okay? Would we still want a program that helped with scheduling?
Yes.
Okay, see, I think we have to keep that in mind, that the scheduling part is, I would say, core,
Yeah.
you know, and whatever that cost is one thing. And then this ability to track types of participation. I don't know how to describe it, but I know you know what it is. So I'm just curious, we'd want to get the scheduling one from someone, no matter what.
Yeah, and that's already in place. We've had that for 2 and a half,
years, yeah.
2 years.
Okay, so this $18,000 is just for the second module?
Uh-huh.
Okay,
Yeah, and Event Temple, we spend
Around 3.
about 3 a year.
it's called the Event Temple.
Event Temple.
Oh my God.
I don't know where software engineers decide they're gonna be creative, but the names on these things always
Okay,
crack me up.
thank you. Do you have any other questions?
What kind of information do you guys take from the participants? Just names, emails, phone numbers, addresses?
Right now, that's about it.
Because that's the only thing we can store. And even in Constant Contact, which we've been using for our communications, it has no way to be able to really track anything else. So in notes, sometimes we're putting in birthdays or relationships. Like you might be a couple, and I'm like, okay, but you share one email address.
Yes.
In Constant Contact, I can only make one contact out of you.
Yeah.
Well, that doesn't work.
I was thinking of that because I know Hispanics
Yeah.
don't have
Yeah.
email.
Yeah.
Or
Yeah.
there's one email
Yeah.
address for
For
whole
the family.
family, or there might be one cell phone number.
Yes.
And we ran into that a lot during COVID
Yeah.
when it was difficult. Everybody's like, well, we'll email the results to you. Okay, well, I'm going to give you 6 names for that email. Oh, well, it can only be to one person. That's not going to work.
So that was a qualifier for all the systems. Can I put someone in just by name or just by phone number? Because sometimes maybe that's all the information. If they just walk into a class and they choose not to give us their email, then we may only have a name. But so many systems are based off the email. So that was like the first thing, like if it was something like Constant Contact where you had to have an email or you had to have this identifying piece of information that we may not have.
Right.
And it will give us the ability to do text messaging, which would be good for the Hispanic marketing and, follow up and stuff.
Yeah. Okay, well, carry on. See where we go.
We're almost there.
Oh, thank you so much. Oh, decision tree. I bet you we're gonna have an image up here?
Yes.
Okay.
Do you want to start with this one or the?
Okay, the
Program
decision-
priority.
The
Next one?
You want to do the other one?
We
Okay.
could do that one. So, it is strategic planning, so we thought we'd, like show you some of the strategy,
The other one?
Yeah.
This one,
Yeah.
thanks, guys.
Some of the strategy that we're putting in and how we're thinking about how do we launch a program? What are we looking for in a program? And some of the ways we're thinking about it. So, and this is, a process that we go through internally. The first thing is, is there a community need? So is there a demonstrated community need? Was it part of our catalyst report or our community need assessments? Was it coming to us through feedback and surveys that we have in the center? Has a partner identified it as a need? Then we're looking at, how it aligns with, with our mission and values, as well as, kind of our prevention focused, accessible, community-based, feel at the center. So that's, obviously right from the beginning, we're looking for that alignment. The other thing we're looking for at the very beginning is equity, access, and community impact. And by that, we're looking for programs that are going to reduce barriers and expand the reach. And, that a lot of people can participate in. And so by that, we're looking at serving priority populations like the Spanish-speaking population. So is that program available in Spanish? Is it culturally relevant in the delivery? But we're also looking at, can it address varying health literacy levels? You know, is there some customization? Because you can have, some of our seniors that are, have some education and have some knowledge about things, but are, looking for a practical approach. And then we have some people who maybe, there's not as much understanding about, about their health. So we're also looking to make things very welcoming at an entry level point. So we don't want anything that sounds too clinical, medical, or that's going to be that it's something very welcoming to people.
Judgy.
Yeah.
Or just overwhelmingly intimidating.
Yes. Yeah, that's a good term. So from there, we're going to look at, what is the program quality? Is it evidence-based, evidence-informed? Is it following some other pilots people have used, best guidelines and practices for that type of program? Has it been proven somewhere? And that would be, our goal is to find those programs that are, quite proven. And so an example I'm going to give of that is, in looking at that is, we wanted to do mindfulness-based stress reduction, was called out by Catalyst, so stage 1. But when we looked at it was very evidence-based, but the equity of having to give up a full weekend and the time commitment for that program would create barriers for some people, as well as the cost for us for the amount of people it would serve. So that's a program where we took it and said, what other evidence-based programs can we use? So we found an instructor that's bilingual, that's certified in mindfulness-based stress reduction in Spanish and in English, very hard to find. And she is going to be basing the program off of all the principles of the mindfulness-based stress reduction program.
Over what period of time?
There's going to be an introductory workshop, and there's going to be a 4-week workshop.
As opposed to the full weekend.
Correct.
I see. So we're parsing it out differently, but the content is the same.
Yeah.
Oh, great.
Yeah. So it'll be on all those principles, and then we're going to go into a once a month to continue working on those techniques. So we're also going to be looking at, like, is it feasible for us, like right now? Who's the instructor? It's great to have everything else, but that's something that we've run into where we've identified things, but who's going to be able to deliver it? What does our calendar look like? When can we, fit it in? We're only open one Tuesday a night. So how do we, strategically put things in so that we have that Tuesday coverage and not too many things on one night or not another night?
But also balancing that thought with, as we look into growing into maybe another night of the week or more weekend days, we've got to make sure that the days that we're already paying to have staffed are full.
Yeah.
And we're nearly to capacity on that. Once we're at capacity, we only have one choice. Well, we have 2 choices. Don't grow any more programming.
Right.
Or
Add staff.
to be able to do additional timing.
Yeah. Good problems to have.
Right.
So then, of course, financial. And financial comes in now. We don't want to discount something just on the price tag, because maybe there's other ways to do the programming. Maybe there's a partner that can help us in delivery. Maybe there's, other options out there that we would want to explore. So at that point, we're looking at, what is the cost to launch the program? What is the cost to sustain the program? And, how does it fit into the budget? Like, maybe it's really, really great, but now it has to wait, a few months for the next fiscal year to be able to work in those financials. And lastly, we're looking at, is there a visibility value and partnership value? Are we bringing in other partners in the community? Does it heighten the level of the district? How is the district going to be regarded doing programming like this? Is there some recognition involved? And then being sure to be able to put that in, to our marketing and different things like our CDC program that we have with lifestyle change, has that strong visibility value. So those are the pieces
That's
that
great.
we're looking at.
Wonderful. I think those are all the checkpoint Charlies that we need to do every time. That's great. And it's working well for you all.
It is. It is. You're going to see some programming coming forward that has, we've had to wait for the operational feasibility. We've had to, for that instructor that now will be able to happen because we found those partners.
You want to go to the other slide?
Yeah, sure.
So this is our, go ahead.
The font is just really tiny, so
Do you want?
let's see if we
Keep
can
it
expand
bigger.
it a little bit. And then we can move it around on the
Yeah.
screen as necessary. Oh, you guys have it in your,
Yeah.
oh, here,
Copies.
there's additional copies.
You bet. Thank you.
Even if you can even scroll down just to the, where we started at definitions, if that's easier.
Okay.
So, a lot of the questions that we receive are kind of like, what types of events do we host? And so working kind of from the bottom going up, we've identified that we have workshops that are often single days. We also have series, which are multiple days, and then we also have program, which are long-term. So our workshops, the single day workshops are really important. We have a lot of instructors that contact us, prospective instructors wanting to teach something. And after we do our due diligence and verify, the quality of information that they would provide our community, we will test them out. And so we'll provide a single day workshop. We do our best for us to either be present to observe their teaching style, or we rely on the surveys, after the class to get feedback from the participants there. And these single day workshops also allow us to do like one-off events. So we may have a number of, maybe a group of people that are saying, oh, I want to learn about hypertension, or I want to learn about, something very, very specific that maybe there's not like a series or a multi-day. It's just, I had one of the workshops that was requested of me was, can we talk about medications for type 2 diabetics? That was a single day workshop. So we're able to get really creative in what kind of workshops we provide. If these instructors that are coming in are providing something really awesome, and we know that in their resume or in their background, they do series like multiple days, which we're running into with our mindfulness program. We have a really amazing instructor named Christine who came in for a single day, and she teaches on self-sabotage. This was a referral that came to us from Michelle's place. Now she's teaching multi-day and is part of our mindfulness programming. And so each of the workshops oftentimes will feed into the series. And then sometimes the series or even the participants in the series are going to feed into our long-term programs. And so these, our long-term programs, these are exactly what we're saying. These are long-term. These are your lifestyle change. Perhaps mindfulness, or the program could be, gentle fitness, kind of like our categories, of the various, topics that we teach at the Wellness Center. And so what we did, in this diagram, you'll see the definitions of the program so that there's some clarity around that, examples, and then also the reason behind this. Each one of our programs, I think for us on the district side, it's really receiving feedback. Information from our community. Do they like this? What other programs do they want to see? When is it that they want to see these programs? Because based off of our demographic, there's different wants, needs, and desires. Currently right now for this, starting in January, we're leveraging our Tuesday evenings for a lot of our kind of mental wellness, leveraging Palomar Family Counseling to come in and do their, wellness coaching, events. We have for our younger families, we're targeting on Saturdays. So we have nutrition classes coming for kids, both in English and in Spanish. We have mindfulness programming coming also for English and Spanish, and we're targeting the newer, younger families. And then during the weekday, that's when we're targeting a lot of our senior, community, our older adults. So we're kind of parsing out based off of demand from our community when we're providing these so that we can hit all of our target audience with the hours that we're open.
And this was a ton of work that I know Bianca spent a great deal
Deal of time, and then she and Teresa have been really parsing it down because it was one of those big confusion points.
Sure.
We were growing and building the plane as we're flying and all of those.
This.
Right.
And it
And
makes sense in our heads.
yeah, we knew what,
But.
and
Yeah, but not even always the same, because I would be like,
oh, that's a district owned program. And they're like, so we're paying for it. No, no, we don't pay for it.
Yeah.
We own it.
Yeah.
Okay, wait. And so we had some workshop kind of style conversations where we outlined, okay, well, what do we mean if we're going to define whose program this is? Is it a program or is it just a seminar? And so really outlining these things has taken these ladies a ton of work and a lot of conversation. Teresa is still writing policies, procedures around this so that we have a working document so that when some of us, retire, win multi-million-dollar lottos and walk away, this foundation work doesn't disappear with us.
Yeah.
So.
Great.
Well, it's singing my song. I love what you've done here and gathered around common terminology so that we can discern things, and it'll help us in discussing for sure.
and this framework should really help whomever the consultants are that come in for that community needs assessment
To be able to work within our structure and see where and how they're deciding programs that are coming in to this point, how we're aligning it from this growth potential, so that we're not having to develop that at the same time when these folks are going out and doing focus groups and things of that nature.
So when you do the orientation for the interested parties who want to do our assessment, will you include this in that orientation?
Maybe we probably could.
I think it would clarify.
Yeah, I think once, I don't want to muddy it now because there may be people.
No,
who
I
don't-
mean, when
Once
you're
we
gonna-
get our proposals
I know.
from them.
Oh, okay. I was thinking, aren't you holding an orientation for those who are interested in submitting?
No.
Oh, okay. All right.
No.
Okay, well, thank you. This is great. Very good, very good. I want to boot back to the $18,000 thing for a minute here. I'm gonna click back to that magical moment when I had to say to the senior groups in the room that we're not gonna be able to continue funding them because this community thinks we're a majority seniors and we're not, right? And that began a big conversation, and they understood. It was hurtful, but they understood. So I think it would be important, once we get whatever system we're gonna have, is that we include age, so that we can sort through different groupings of participants by age, so we can keep a handle on that. Because it will be interesting to know who has the lion's share of time and attention by age, so that we can adjust as we go. So just would like to request that if I could. Okay.
The age of this, we just want to see who is participating.
So when, let's see, must be 4 years ago now,
Probably, yeah.
a huge amount of our grant money was going to people 65 and over. A huge amount.
50 to 60%.
Yeah. And they wanted more.
Oh.
They wanted more and more and more and more. And where's our therapy pool, right? So I took the opportunity to say on grant making night, when we were announcing the grants, to address the elephant in the room and say, we're not going to do that anymore.
Because seniors represent about 20 to 22% of the population.
Right.
But you're getting 60% of the
60% of
funding.
our money. And so that's why we need to know age and to stay on the razor edge of how we're distributing it in terms of programs and opportunities. It's an equity issue. Everybody pays taxes here, property taxes, even renters. I have to constantly remind people, oh, they're renters, they don't pay property tax. Yes, they do in their rent.
And then
The
property owner-
landlord, the owner of that land builds their cost of property taxes into the rent. There's a direct line. And just as an aside, those same people say, oh, those people from Camp Pendleton on our roads, they don't pay taxes, right? And I say, you realize, roads are paid through gasoline taxes and they buy gasoline. So there's this whole bill that goes on that we've got to correct along the way.
Mhm.
And part of equity for ages is part of what I think we need to think through. Yeah.
And I think we've had quite a few conversations from programming level of knowing that the low hanging fruit when we first opened the doors was any program, anytime, whatever we can do, let's get people in the door,
Yeah.
right? And of course, daytime programming is gonna be for either those who are retired
Yeah,
or those who can somehow stay at home,
that's what I was thinking.
right?
Like, it's gonna be hard to get accurate numbers, because we are very limited on afternoons where people have, people my age who are working.
Right.
And their programs are not available for them. It's gonna be hard.
But see, that's the exact analysis that we can make in this committee to say, we need to move programs to evening
Yes,
and Saturdays.
that's what, whenever you said, go by age, I was kind of like, it's gonna be hard if we're gonna be seeing that who it is that is in our programs are gonna be obviously the
Right.
people who have availability for the programs that we have available for them.
That's what we
Right.
want to know.
Yeah.
And so,
But there's no reason that should be the status quo.
right,
Yes, no, I understand what you're
Okay.
saying now, so I was just like, it's gonna be hard.
Yeah.
to get that
But
data.
by having the absence of that age group data, that points to the fact that we're not providing services to that group.
Yeah.
Whether it's a certain child group, middle teenage group, younger adult, career adult, whatever it is, we know that we're not serving all the age groups right now. We absolutely know that.
Yeah.
So the idea was we're growing from this, okay, anybody, everything, let's get to targeted programming. And that is where Teresa and Bianca have spent a lot this last year, especially, really trying to identify and fine tune what we are doing existing, what's working, to making sure those Tuesday night programs fit, that Saturday is an option. And then from there, that led to some of this conversation around this community needs assessment to say, all right, young working professional, what could we actually offer that you want to come to? That you're going to give that valuable after work time or that valuable weekend. What can I entice you with that you're going to show up to? And then from a different demographic bucket, our Latino population, what are they going to come to? Because that may not be the same, obviously,
I know.
right?
Usually they have kids too.
Right. So if it's family programming, is it full family? Like the kids are, and by kids, family-ish,
Yeah,
because we're not gonna be doing daycare.
yeah.
Right.
So how do you begin to find those partners? And then the other part is to grow outside of the center. What other partners could we work with that have a resource that we don't, that could offer something? So trying to look at all those pieces, and that absence of data will tell us a great deal.
No, I like the way that it's going, where you guys are perfecting what we can do now. And then later, look at what's going on. Look at it where you're not being blinded. You're still looking around.
Yeah.
And I totally.
The windows are still open.
Yeah, I totally agree with that.
Yeah. Because there are a ton of things that we could do. And the first thing that Teresa kind of presented on those priorities really helps guide, okay, what's coming at us and what don't we see? What don't we have?
Yeah.
And how can we find a way to fit that in there? And to Teresa's point, it is a lot of work around finding an appropriate facilitator. We know, talking about grants, that we will have to pay for programming to come here. Okay, that's fine. That's why we have property taxes.
Right.
So let's make sure that it is hitting all the people who could use that, and not just we'll do it on Thursdays at 10 o'clock in the morning because that's easy for us.
Yeah.
It's not about us. It's about those, them, they, folk out there.
Do you guys get people coming in kind of like frustrated because we don't have these kinds of programs, or is it? No.
No, I wouldn't say frustrated. I think more people are just so excited about that something's happening and what is being offered. It's more, that's what we hear. And we have had stuff on Tuesday nights, and Saturdays this past year, so we've been able to guide people to there. So not necessarily frustrated.
Yeah, we just today,
Interesting.
we had our CCHW meeting and we had a remarkable 15 different organizations showed up. And during that meeting, there was a question like, if somebody says, we need to have more nutrition classes for kids and they need to be in English and Spanish. And I'm like, well, guess what? Saturdays. And they're like, oh, you're doing it on Saturdays? Awesome. So people are getting really excited, and it's almost as though since it hasn't been here yet, they don't realize that they miss it. And so when you're able to provide these opportunities, then it's also really great. But also speaking about our Spanish speaking community, and this is one of the reasons why Teresa and I are targeting both Tuesday evenings and Saturdays. Portion of them, they have family soccer on the weekends, and that's what they do as a family religiously on Saturdays. And they're asking, can you do something for the Spanish community in the evenings? And so we've had our Loteria night. That was amazing. We had like 43 some odd people that came in the middle of the week, and we're working with our other relationships like Community Housing Works or Boys and Girls Club. We're getting feedback from them as well about what works and what they see, works for scheduling. So we got a lot of really great community support.
And the last, we do a wellness walk of Land Conservancy on a quarterly basis. And January, they had a big turnout.
Yeah,
30 some. I know
Um,
you sent me a great picture of it. And then I went to the community forum meeting and one of the gals from Land Conservancy was there and pointed out the success of that walk and how it's rippling across, their regular folk as well. So we're seeing a growth of awareness and participation across both entities. That is a cross-pollination that I think is important to this community. So you don't have these siloed groups. Jennifer may be part of 4 different groups, but she doesn't know that those 4 different groups could work together. Well, because they haven't been.
Yeah.
Well, this is a great opportunity for us to be able to bridge that more.
Because vitamin N and physical well-being is on everybody's ticket that they want to do well by. So excellent. Very, very happy. Okay. All right.
I have one.
Yeah,
Please.
I was gonna say, does anybody else have something?
Ooh, pick me. Okay, I didn't make it an agenda item, but I think it's something to bring up for awareness. As we're looking at new programming, as we are looking at investments in different priorities, growth priorities in a longer run, besides brick and mortar growth, I think it's time we consider a plan for developing our ability to receive grant funds.
Going at
Foundation and or for district.
Oh.
And I don't mean like the small FPUD funds, not that $120,000 we're getting this year is small.
Yeah.
But I think for some of the different priorities in the future, we may need to look at multi-year, potential multi-million-dollar grants. That is going to take extensive research, planning, grants management, all of those pieces. While I know how to do that, I don't have capacity to do that.
Right.
So I have been having some conversations with a few different groups that do grants specifically for municipal special districts. And the example I'll use here is this year, North County Fire has been just hitting it out of the park. Those crazy guys over there are really leveraging those resources to receive grant funds to build new Station 4 in Rainbow, to outfit new equipment, all kinds of things. So between the group that they're using to contract with to get grants and another group that I had a conversation with, usually there's a lot of startup before you actually start doing your applications. And we know that federal funds are wonky
Are fragile.
right now. They are still occurring. Same thing with state funds. And we're not in the queue for any of that.
Right.
Because to get into it, we have to have a certain level of preparation.
Mm-hmm.
Strategic planning is obviously where that's gonna come from. Bringing those priorities to the forefront and then saying to potential grant vendor, hey, we wanna go after funds that can support this kind of programming.
Mm-hmm.
They go out and they find it, they help us write that application. Then if we get it, they can help us manage it from the reporting side. So that will not be free.
No,
Right?
Yeah.
So I'm gonna look into what that is. A lot of their questions, first and foremost, as good grant writers would ask, is what are you looking to have the money do?
Mhm.
Right? What are you looking to support? So we may want to make sure that as I'm talking to these groups, if we decide we're gonna go this level, we're advising them based on programming needs
that we know that we want. That may be a year from launch. So I just wanted to start that conversation here. So that if I come forward and say, here's an example of a type of grant that we could have gone after. This is what it would have taken to get there, so that this group, this committee, is informed most on the process. I think you're familiar with the grant process. I don't know if you've ever been through the grant process other than ours. So it can be fairly cumbersome and long-term, but it's an important piece for us to be aware of. In 10 years, we're going to need external funding sources for all the things we want to do. If we want to be open 5 nights a week, we can't do it with the property taxes we get, even if we stopped grant funding for everything. Because if we do get clinical services online and we want to continue to grow these other programs, we're going to need external funding sources.
so, I'm reading it, and I get it. I think it makes sense because organizations have to either decide that they have internal capacity and pay that way, or external as needed. And my sense is we're at the external as needed and can be very precise in the type of grant writing expertise and focus a given group might have when we spot something or send them sniffing around based upon what we're interested in, and they bring us ideas. So I would support pursuing that idea. How do you feel?
I don't know much about it, but I was with the fire department. We did a lot, but we have to make that for us, so.
Great.
I would just get what we got.
Yeah. So I talked to Keith about who they've contracted with for that.
Yeah.
And again, it's part of this little CSDA, special district world, right?
Yeah.
Because we're niche enough that, just writing municipal grants isn't something your average nonprofit grant writer typically does.
Yeah.
It's a different skill set. It's a different search capacity. So one of the groups, and Teresa, I think you and I met with them. Or did I meet with them directly?
I don't think I met with the group with you.
Might have been just me and my brain. Okay, me and the mouse in my pocket.
I think so.
Or the chicken in my pocket. We met at the wellness center. We're able to kind of talk about kind of the programming that we're doing out there. And this, wouldn't it be great if we had this kind of program? Wouldn't it be cool if we were able to support this kind of need? All right, well, what would it take for us to be able to grow there and do that? Well, it's going to take money mostly, right?
Yeah.
That's what it's going to take.
Well, the good news is as a property tax-based
Governmental agency, we have a sense of what is going to be constantly there.
Right.
And we can make a strategic choice to put in $200,000 into grant making with the potential of a $600,000 return, because we have this ongoing base of funding that we can use, which many nonprofit, the Arts Center, we don't have that.
Right. And because,
And we need to leverage that predictability
yes.
in order to secure the future.
Right. And we can't go after the same kind of funds that a regular traditional nonprofit would go after, because a funding
Agency would look at us and say, you're worth more money
Yeah.
than we should invest in you, and you're already giving money away. Why would we give you more?
Yeah.
And that is a hard sell to a private foundation, but to other municipal funders, that makes sense.
Yeah.
Yeah.
So I wanted to bring that up here, so as I'm having these conversations, I'm not taking a next step until at least this committee is aware that I'm having the conversation. So just want to make sure that that was brought forward, because I do see it for not only our strategic initiatives and programming, but obviously we still have quite a bit of building costs that are coming up. Obviously, those building costs are expected to come out of the corpus of money that we got from the sale of the hospital, that like for like there. But once that money is drawn down,
We're done.
there's not going to be another hospital building to sell.
That's right.
Now, we're ahead of the game right now. We need to stay ahead of the game.
Right.
And we're thinkers enough that we see it coming.
Yeah.
On the horizon there, so we'll get on it.
So I
Thank
just
you for
wanted-
bringing that up.
Wanted to bring that up.
And this is the right committee to bring it up.
It is the right committee.
Strategic planning. Love that. Okay. Board member comments and future agenda items. Anything you'd like to see tonight? No? Okay, your butterfly is going like this though, are you sure?
No. I need to fix my hair.
No, it looks beautiful. I'm just- Okay, I have no other comment except to thank you all. You've mentioned a future agenda item potentially.
Yeah, and I won't put it on the agenda until I have something more definitive.
Yeah.
So obviously, I'll reach out to the same vendor that North County Fire is using. They've had a lot of
Sniff
success.
around. I want you to start flirting.
That's not a problem.
That's what I tell like principals who are getting ready to move up. I say, you gotta start flirting.
AKA
You can't,
networking.
you gotta flirt a little bit, you know? So, okay, anything else for the good of the cause? I will adjourn the meeting at 6:24. Pleasure doing business with you. Thank you, everybody, for staying late.
Thank you.
And again, special thanks to Bianca